Hello all, I'm Jen Bartz, the president and founder for Heroes Path Palliative Care. In the midst of the current health and economic crisis caused by COVID-19, we wanted to take some time to share an update from Heroes Path. First of all, we know that many people are grieving the loss of work, social interaction, or even the loss of a loved one. Many are facing fears about what would happen if their vulnerable loved one gets this novel coronavirus, and others have concerns about paying their bills. Some people have all of these things converging into a scary, formidable storm. We want you to know that we are here to offer support, comfort, and understanding at this time. Please reach out if you have needs that are not met. We can either meet them as an organization or connect you with various social and spiritual groups who can. Next, I wanted to talk to you about what it's like to be a family of a child with serious illness at this time in history. Many of these families are coping well because this has always been their lifestyle, and their mode of operations has always been one of protection, prevention, and preparation. They have lived this way because a common, simple cold could bring their loved one to the ICU and require ventilation to live. What is different right now for them is that while they always had these concerns, now they have increased shortages of medical supplies. They have always been resourceful and managed living with just the bare minimum supplies before, but now other people also need these vital supplies, so they are experiencing the shortages like never before. They are also living with increased fear of some sort of new symptom or emergency that would bring their loved one to the emergency department. Our families we plan on serving already frequent these spaces and have frequent need for hospitalizations, but the desire to keep their child away from these admissions is more necessary than ever. Home-based palliative care has been shown to drastically cut down the need for emergency department visits and hospitalizations. We wish we could be in their homes right now, making sure their urgent needs are managed within the safety of their own walls. But this has helped us see that our services are needed more than ever, and we need to push harder to get established and help these families navigate and overcome these challenging times. As you know, we have been designing and building our program, and that work has thankfully been able to continue. We have made new connections to various groups and businesses that has helped us progress in our design stage, and we hope to have all the building blocks in place as soon as possible so we can start services for children in their homes. A lot of that work has been and can continue to be done in our separate homes, and our work continues on despite the challenges. We have been working on partnering with a few established groups, which would enable us to provide services much sooner than if we were starting from scratch. Because these organizations are busier with COVID-19 issues themselves right now, we are working on logistical parts of operating a nonprofit. The IRS has let us know that we can expect to have our 501c3 designation within the next 2 months. And we're also working on business plans for fundraising, marketing, and policies and procedures. We hope that all the work we're putting in right now will allow us to hit the ground running once restrictions are lifted and our potential partners have more time to devote to our program. If you have any questions or concerns at this time, please feel free to reach out. Check out our Facebook and Instagram and website for information on how to connect with us. In the meantime, please remember these remarkable families and children as they continue the hard work of navigating the medical and educational systems with even more challenges than before. If you happen to know a family with a child with serious illness, check in on them. See what you can tangibly do for them. Maybe you can pick up or drop off groceries, or maybe you can bring some cheer to their household in some way. There's also a need for educational toys or therapy devices that would help with the child's new way of having to do their therapies. Just ask the family what may be helpful to them. Thank you for watching, and please reach out with any needs that you have at this time.